Right, so welcome to this hangout with Sunny from Simply Teeth. I've recently started using a clove-infused herbal toothpaste, and while I find it very effective, does it have any benefits over normal toothpastes, such as Colgate?
Okay. Well, herbal toothpastes are fine if you want to use them. Obviously, when you use it, make sure it's got fluoride and stuff in it, because that's what's good for your oral health. It's really a preference thing, really. We get patients asking us, are herbal toothpaste better? Personally, I don't recommend them too much. I use Colgate myself, simply for the fluoride factor.
Right, so the next question is, how do whitening toothpastes work, and how effective are they at whitening teeth?
Okay, so whitening toothpaste, obviously they're not as good as professional whitening, as in coming to your dentist and having them whitened. How they work, in a simple way, they physically sort of knock out stains from little tubules in your dentine, and that's really how they work. Are they as effective as proper professional whitening? No, they're not as effective as proper professional whitening, but they do have a whitening effect. Again, I personally, I get we get patients asking us, we always recommend sort of professional whitening, but we do get patients asking for whitening toothpaste, and the ones we recommend, Opalescence, and there's a new one out by Breathe RX by Philips. They tend to work quite well.
Right, thanks very much. And next question which came through was, I have a fear of visiting the dentist, and have had for a while, although I do realise the importance of oral health. What can I do? Okay,
so we get, again, it's a very, very common thing. Lots of patients are scared of dentists. We get people coming to us all the time saying, oh, I hate the dentist. We're not all that bad. It's a personal thing. Fear usually has come from some sort of childhood problem they've had, and it's if you come regularly to a dentist and gradually build up a rapport with your own dentist, it tends to diminish slightly. It won't, hopefully it will just disappear. Just spending a bit more time with the dentist, or the dentist spending a bit more time with you, explaining things properly, things like numbing up gels, sedation, just making you feel a little bit easier. All those sort of techniques help. But yeah, it's just really about having a good rapport with your dentist. We get a lot of new patients. Within a couple of visits, they're a lot better. They're still slightly anxious, but they're a lot better. And that's how we sort of build up clientele, really.
Righto, cool. Thanks very much. And next question we had, which was from obviously one of our patients that came through. I get sensitive teeth after brushing. What can be done?
Okay, sensitive teeth after brushing.
And also, in fact, it's usually after having my teeth cleaned.
Right. So you can go to your hygienist to get them cleaned, or you can go to a dentist to get them cleaned. When you have them cleaned, what the dentist or the hygienist is usually doing is taking off plaque and tartar off the teeth. Usually it's on the enamel, sometimes it can be on the roots, and it's also a cause of gum recession. So when you take the plaque and tartar off, you tend to expose sometimes enamel which wasn't normally exposed, or dentinal tubules which weren't exposed, or even roots that weren't previously exposed, and they can cause sort of sensitivity problems. Things we recommend: tooth mousse. We recommend Sensodyne toothpaste. It's quite a common thing. It's nothing usually to worry about. If the sensitivity persists, then they should go back to the dentist and see what's going on with it.
Cool. Okay. And next question was: is an electric brush better than a manual one?
Okay. If you're doing a really good job with a manual toothbrush and you go to a dentist regularly and he says there's nothing wrong with your teeth, there's no gum problems, then there's nothing wrong with using a manual one. But there's lots of patients who can't get the sort of grasp of how to use a manual toothbrush properly. The electric one, basically, all you need to do with it really is put it on the tooth, and it does the right sort of motion for you. There's lots of different electric toothbrushes out there. I personally always recommend a slightly better quality one. Make sure you try and get one with a pressure indicator, or something which sort of stops when you put too much pressure on the teeth, or indicates that you're putting too much pressure on the teeth. We recommend a lot of sort of electric toothbrushes, and so does our hygienists. The ones we usually recommend, Philips and the Oral-B range, we find they work really well. But it's something you need to talk to your dentist about, and something you need to talk to your hygienist about when you see them.
Right, thanks very much. Next question came through regarding gums. Obviously, gums bleed when I brush them. Is it something that I should be concerned about?
Okay, bleeding gums. It's not. Well, a lot of people in the population have bleeding gums. That doesn't mean it's absolutely normal. They should get it checked out. Usually, a few reasons why they bleed. Firstly, if they're not being brushed properly. Secondly, if they've got some sort of gum disease. Thirdly, if they're sort of on some sort of medication that can cause sort of side effects on gums. Really, really important. They go to a dentist and get it checked out. For bleeding gums, there's things dentists or hygienists can do. Deep scaling, just usual cleaning, just going over oral hygiene. That can usually improve the situation quite well. In the odd circumstance, they may need to be referred to a specialist for that, for the bleeding gums to see what's sort of going on with it.
Superb. Okay, and I've heard about fast braces. How long would I need them for?
Okay, fast braces are a new concept from America. Typically, what we recommend is 3 to 7 months. The beauty of fast braces is it's a ceramic or metal bracket, whichever top one you want to go for. The beauty of it is it actually causes sort of root movement, so you have to wear retention less afterwards, so retainers less. It can be used on kids, through to adults. I've been working with it for a number of years, and no problems with it really. Get really good results with it. We do that, and we also do 6-month smiles. Both systems work, and the average time span is about 3 to 7 to 8 months.
Okay, so Sonny, if I can stop you there for just a minute and ask you, you mentioned 6-month smiles.
Yep.
How long do you actually wear 6-month smiles for?
Okay, 6-month smiles, as the name says, usually about 6 months. Average, what we get told is 3 to 9 months for most cases. Some cases can be done within 3 months, some cases take about 9 months. There are the odd one where their teeth movement is a little bit more difficult, it can take a little bit longer, but generally 5-6 months, and you get the results you want.
Right, okay, and next question came in earlier on, which was how can I replace a missing tooth?
Okay, lots of options. First option, if it's at the back, you don't always have to have it replaced. If it's at the front, you don't have to have it replaced if you don't want it. You can have a denture, something you take in, something you put in the morning, take it out at night. You can have a bridge. There's different types of bridges you can get. Sticky bridges, what we call conventional bridges, where it involves sort of cutting the teeth either side, or sort of not the newest thing, but the most conservative thing I'd say is implants. If your bone and your medical history allows it, which is basically putting a titanium screw into your jawbone. Sounds horrible, but it's not. It's just like taking a tooth out and putting one back in, and sort of fixing a tooth onto it after about 3 to 4 months.
Right, okay, and the last question which we had come in was, I think I grind my teeth. What causes it, and how can it be fixed?
Okay, again, very, very common thing which a lot of patients have nowadays. Usually it's stress related, or something's going on with their lives, exams, divorce, whatever. There's things we can do to sort of counteract that. Firstly, just try and get the patient to relax. There's certain jaw exercises they can do to try and relax their muscles. If that doesn't work, there's things we can actually make, like sort of bite guards for them to wear at night or during the day, whenever they think they're grinding teeth. And what that does is literally sort of relaxes their muscles and physically stops them grinding.
Right.
Grinding can have quite a bad effect on teeth. It can cause headaches. It can cause chipped teeth, it can cause wear on the teeth, it can cause gingival problems. Lots of things can happen on grinding. So if you are a grinder, it's quite important you go on to your dentist and get it checked out and see what they can do.
Sure, and we've actually just had a question come through now, which was, what is a crown and why would I need one?
Okay, a crown, basically, simplest way of describing it is a covering over the tooth, over the whole tooth. It's like a cap, basically, over the tooth. Usually, well, there's a few reasons why it's done. Firstly, it can be done to improve the look of a tooth. If it's got big filling in it, if it's the wrong shape, if you can change the colour of it, it can be done. Second reason, if there's a problem with the actual tooth itself, it's got a crack on it, it's got a very large restoration, that's one of the reasons. Most common reason for us tends to be after root canal treatment, because after root canal treatment the teeth can become quite brittle. With a crown you get really, really good sort of like a coronal, a seal, and it also stops the tooth sort of fracturing or bits of it coming off, because you tend to put more pressure on it without feeding it.
Right, okay, and I think if anything, I've got a few questions myself. How often should I be coming to visit the dentist?
Okay, first thing you should do is go to your dentist, and they can actually tell you what your sort of time interval should be. Some people need to come in, well, I always recommend every 6 months. Some people, they come to you after 5 years and there's absolutely nothing wrong with the teeth. They've got perfect hygiene. You don't really need to see them every 6 months. You should, even yearly. Some people come in and they haven't been for a few months, but they still need to come and see you because they've got problems. So some people may actually need to come more frequently. Incidentally, coming to the dentist is not just for the teeth. We also check other things, the tongue, the cheeks, the palate, lots of, we do basically sort of cancer screening of the mouth. So it's not just about teeth, it's about the gums and the...
So you'd say it's about general health as well?
Yeah.
Righto, cool. Alright, well I think that kind of covers everything off, if anything. Are there any general kind of points and tips that you'd like to give our viewers today, Sonny?
Yeah, go and see your dentist regularly, brush your teeth twice a day at least, and keep smiling.
Excellent. Thanks very much, Sonny.